Obesity is fast becoming one of the largest issues that we have to deal with in the peri-anesthetic period. Obesity in the cat population is actually considered epidemic, and there are lots and lots of dogs that are becoming obese also. It's estimated that 59% of cats are overweight, but that 39% are actually obese. So what's the definition change between just being overweight and being obese? Well, obesity is considered to be patients that are 15% over ideal body weight. Now, how do we know what a cat's ideal body weight is or a dog's ideal body weight? I mean, there's charts in people that make it so easy to look at and say, oh, you're this high and your bone structure is like this, and so you should weigh this much. Well, in our animal patients, we just have to look at them and basically as an educated guess, what's their frame size? How much weight are they actually dealing with that's over what we would expect them to be for that frame size or that body structure? And that has a role in actually determining anesthetic dosing. So that's why it's important for us to be able to put our best guess on how much a patient should weigh in an ideal situation. And this poor kitty cat has this beautiful hair coat, and he's physically obtunded by his structure where he can't reach around and actually groom himself anymore. So not only are there physiologic issues, but there's also grooming types of issues and husbandry kinds of issues when patients become so obese that they can no longer take care of their own basic needs on their own. So what contributes to patients becoming obese? And overnourishment, absolutely. In the US and in the UK, we have very high calorie dense foods that are very tasty. Cats like them, dogs like them. Our pets have a place in our social structure that puts them as family members and not just considered to be animals which are utilitarian in purpose. In developing countries, oftentimes pets are still seen as a utilitarian type of purpose. We bring them into our homes in the UK and the US and other nations that have placed animals societally as family members, and we feed them and we give them some enriched environment to be in. They could be in a small apartment, they could never go outside, they could have lack of ability to exercise. So that's a small place where there's not a lot of room to run around and kind of stretch out and run, or there's lack of desire to exercise. I mean, let's face it, who wants to run on the treadmill if we didn't have to, or we didn't believe that it was good for us? So getting cats to exercise is very difficult, and dogs to exercise also is very difficult. They're predator animals, and so that prey chase is innate in their brain, and they do like to chase things and they do like to run after things. And so us being attentive to their needs and actually promoting their exercise is about the only way we can get them to exercise on a regular basis. That means we also have to do something active along with them. And so time to do it, space to do it, all of that contributes to the problem. Well, why is obesity such a big deal in the first place? Well, the largest issue that we see in the peri-anesthetic period is obesity's effect on the lungs. Yes, there's a big abnormal cardiac workload that's placed on the heart and the vascular system also. We have slowed hepatic metabolism in obese patients. We have a hypersensitivity to pain in obese patients, which all will play a role in cardiac stress, length of anesthesia. Remember, we can lose compensatory ability strictly by length of anesthesia alone, even in apparently healthy patients. We have slowed hepatic metabolism, which can delay drug metabolism, which will lengthen the duration of effect. And obese patients have a hypersensitivity to pain. And it's still being kind of worked out what contributes to that. But oftentimes they'll have body pain that's more intense than patients who are fit. The respiratory compromise actually comes from a few different areas. Decreased interthoracic volume simply because of the deposition of fat in the mediastinum and all around the thorax, and actually inside the thoracic wall also.